Okay, a very good evening to all of you, my friends, well wishers. Dr. Richard, good evening to you,
Good evening, good evening, good evening.
and welcome once again to our program.
Thanks for the invite.
You were missing last week, I guess,
Yeah,
because of duty,
yeah.
but we had a pretty interesting discussion last week with folks, and I want to continue that discussion because I keep seeing the same pattern all the time, and that is many persons as we go on are having family members, even some themselves, who are sick with a number of diseases: high blood pressure, diabetes. Some persons can't see, they're losing their vision. Some are having difficulty breathing because they have cardiovascular or bronchial issues, simply as asthma. Some persons are having high blood pressure and the numbers are not going down. Some are having high blood sugar and the numbers are not going down unless they take the drugs.
Mm,
And it all comes pretty much down to some simple facts. And I spent a lot of time discussing those facts last week, and we want to spend some more time again doing that. And that is dietary factors. Many persons are sick today because they're eating foods that are causing them to be sick. They're drinking liquids that are causing them to be sick. They're forming and having habits that are making them sick. Some persons are smoking themselves to the grave. They can't stop smoking, they say. They just keep on smoking and smoking and smoking, one cigarette after the other.
mm,
Some persons live in the rum shop. You see the rum shop. They drink alcohol from the time that the day breaks until they stagger or fall asleep on the side of the road because they're drunk.
mm,
And it is something that we see a lot because many persons don't understand how the body system works, what makes things happen. Why is it that some people never get sick and a whole lot of others are sick all the time? And when we look at the factors that are contributory factors to why the persons are not getting sick, it has a lot to do with what they eat, what they drink, and the lifestyle that they have. So I wanted to spend some time discussing the lifestyles that contribute to the sick state of things. The hospital beds sometimes are filled. Persons have to be in the emergency room area because there are no beds. You know, there's some persons who are at home in their beds and can't get out of bed. They can't get out of their beds because they're so sick. So why is it that we have so many persons who are sick and are not able to overcome their sicknesses? Is it because they're not made aware of what is causing their sicknesses, or are they sick because the system has them sick? They're on drugs of all sorts, and one drug contributes to another problem, and another drug contributes to another problem. And the organs are maybe tired and are about to, sometimes they give in, the organs just give up because They're beaten so bad with the drugs or with the habits of foods, the parasites, that they just can't go anymore, and they sign off. They
Mm.
kick the bucket. That's it. How can we advise persons, and it goes. I started this conversation coming out of constipation, because many persons are constipated and they don't know they're constipated,
Mm.
and they keep reabsorbing matter that should be excreted, and they go to the toilet once a week or sometimes once every 2 weeks, and sometimes they're told it's okay. It's okay, but they're eating all day, every day. So what what else can we do to maybe help some people who want to get help, to maybe sit up out of their beds and then stand up from their beds and start walking again? It's a sad thing, because we're losing persons every day, and we're losing them because the phrase is that they're digging their graves with their teeth and they're eating themselves into their graves. I've been saying that for years. They're digging their graves with their teeth and they're eating themselves into their graves.
Mm.
And when it should be the opposite, in that your foods should be like medicines to your body, and your medicine should be the foods that you consume. So I don't know if you want to shed some light on all of that, and then we can start from there. And then I wanted to mention that persons can call their friends and their families and their buddies and so on. Let them tune in. The information is on the screen there. They can tune in. They can either tune into the television, or they can go to the YouTube and typing Dr. Joseph Haynes, and they'll come up live, and they'll be able to call and make a contribution. In other words, if they have a problem and they'd like us to somehow give them some advice, they can call us, and we can try to give them some good advice as to where to begin with their journey to better health. So I don't know if you want to open with something.
Uh, I mean, you said a lot. There's a lot there, and unfortunately, the health of a person lies in that person's hand, and the reality is that people have been making very poor dietary choices. You know, a lot, not everybody, but most of the people, most of us amongst us, even some among ourselves, are making poor dietary choices. And um, I think we're living in a society where we like quick and easy access to things. The fastest way to eat a meal, breakfast or lunch or dinner, is to go and buy it. You don't have to prepare it. You don't have to spend time making sure that it's prepared well, safe, and that the content of the preparation is healthy. So it is a quick life, quick choices, and quick uh, access, and then quick diseases and quick death. Everything is quick. So it began with healthy food choices. Most of what when we go to the supermarket or we go where we get our foods, most of it is already processed. And we start out, the food is already processed, so all those chemicals in it it's a big problem, you know. And like you said earlier and before, many times the best way to do things is If you can grow your own garden and you can prepare your own food sources or get your own, food together, that's the best thing. But many of us are not in that, you know, in that,
We're not in a position to do that.
and we rely on, what's already prepared. You know, there was a study done in, I think it's 2019, and they were really, really were looking at exactly how people began their day. Because you begin your day with breakfast, and they came to the conclusion that if you were to eat or consume uh, 4 servings of processed foods a day for breakfast, you have a 62% mortality rate. And these are foods that some of us eat, like white bread, chips, donuts, cookies, granola bar, protein bars, uh, all the beautiful breakfast cereals, even instant oatmeal. Not oatmeal, but instant oatmeal. And then we drink a coffee with creamer, or some people go and they do a milkshake. Some people have done sodas. So that study have shown that people who consumes 4 servings of any of those things I listed, they have a 62% chance mortality rate. So what that means is that not long from the time you consume those things, you're going to end up getting sick or ill, and the possibility of you ending up in a chronic condition or chronic diseases is high. And eventually, you have some morbidity and then some mortality. So I don't know what the solution to that is, other than that each one of us have to make a decision whether or not, you know, we have the time to prepare our own meals. And that's really what it is. Even eating out, you go out and you consume McDonald's, Burger King, whatever. There's so many chemicals in those things and so many processed ingredients in those things that eventually, you're walking down the path that you shouldn't be on, So it's very, very crucial that we, if you're very, very serious about health, and many of us are not very serious about health, only when we are very sick, then we become very serious, which is quite late. But if we're serious about our health, we would really take the time to look at the ingredients of what we're consuming. And if many of us are able to really see the ingredients many a times and understand what it is that we're eating, we wouldn't consume those foods. If you can consume a healthy piece of bread that you made, it has no processed ingredients inside of it, no chemicals, it's better to eat that every day and live than to consume those things that are processed.
Mm-hmm. There are persons who would say, "Doc, I really don't have time
Yeah.
to prepare any food, and I don't like leftover food." You hear that all the time. I don't like leftover food. Well, what is leftover food? You prepare this food maybe last night or this morning, or you prepare something that you would consume that night, and then there's some leftover that can probably serve you 2 other times.
Mm.
It is difficult for them to understand that if they were to take the same food that they prepare, and this is we're trying to help here, right? You take the same food that you prepare and you put it in a container. You got to be careful what container now, because you're saying that you get all these microfibers on plastic and all that.
Yeah, it would leach into the
Right.
food. Yeah.
So you gotta be careful what you prepare, what you put your store your food in. Maybe enamel. You can use enamel, but you can't put glass because glass will probably break. So you put that same food that is left over in a container and you freeze it. You put it in the freezer.
Hmm.
This is food that you prepare. Okay. Now that food can stay in the freezer for a couple of days or a few days, and you could use that food again at some point.
Hmm.
They don't see that as something that they can do, but yet still they'll go to the supermarket and they'll purchase a dinner that's frozen, or a dinner that is in a refrigerator. That's a dinner that is made somehow. They would purchase that and they would take it home and they would heat it and they would eat it.
Hmm.
You see? So without even thinking, that food that was purchased in the supermarket or the grocery store that is frozen, first of all, you don't even know how long it was prepared.
It's true.
It may have an expiration date, but you don't know how long it was prepared unless it is stamped on there, prepared on this day, expires on this day. But nevertheless, it is food that was prepared, that was refrigerated or frozen, but it was done by someone else. You don't know what kind of ingredients are in there. You don't know what kind of preservatives are in there. But yet still, you feel comfortable
Hmm.
purchasing that, taking it maybe home or to work, and microwaving it and then eating it, than to take the food that you prepare, that you put in the freezer, that you can thaw out and maybe heat it up at home and consume it again. You
Mm.
know, so I think there's some psychology there that somehow it it convinces the person that it's better to buy it from the store than to prepare it at home and freeze it. You
Yeah.
know, whereas preparing it at home, it will, number one, it'll save you a lot of money. Number two, you know what you put inside.
Hmm.
Number three, it is food that you know doesn't have any contaminants or preservatives because you didn't put any inside. You see, so I think like you said, some of what happens to us is because we make bad choices, we make bad decisions,
It is. Mm.
and
And that,
some of us are lazy. We just don't want to go out there and prepare it ourselves. We're lazy. We say we don't have time, but we have time to be on the phone all day. Every spare time you're on the phone on YouTube or Facebook, you're doing something there when you could be preparing something at home that you can consume when you go to work or when you come home from work. You see, many persons are not aware that their demise, their sicknesses begins in the kitchen. It begins from the choices you make in the supermarket.
hmm
They're not aware of that. They don't think back there. You see? So somehow we have to maybe retrain the mindset. We have to somehow reprogram ourselves to understand that farming it in our backyards or in our pots or kitchen gardens are safer than the farmers' gardens.
hmm
Number one, because you know what you grow, you know what you put inside. You know that it doesn't have any fertilizer unless it came with the fertilizer. You know that. And you know when you pick it, that is something that you grew, that is fresh, that it should be harmless. After this afternoon, today, I'm screening someone, and they're wondering why they're so fatigued, Why am I fatigued? I'm so tired all the time.
Mm.
When you check the brain, when we check the brain was contaminated with mercury and lead.
Mm-hmm. Wow.
Mercury and lead. High levels of mercury and lead.
Mm-hmm.
You see, where did that come from? It could be from maybe filling in your mouth,
Yeah.
maybe from seafood, maybe from water, maybe from some source that you expose yourself to, maybe in the mining area, you know. Um, it's 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 mind-boggling to understand or to read to be able to realize that a person will allow themselves to get to the point where they become so sick that they can't even hold their heads up, than to get to some place where they can be screened, looked at, properly diagnosed, and treated, and put on a path where they can recover. They wonder why we having so much Parkinson's disease,
Mm-hmm.
why are we having so much Alzheimer, why are we having so much dementia. We never used to have those things in the past. All of a sudden, we're having all of these diseases that are popping up all over the place, and hardly it's ever linked to what we do with ourselves. Hardly.
Yeah.
So it is ultimately important that persons begin to realize that the foods must be like medicines to the body.
Mm-hmm. Yep.
I don't know if you want to make any remarks there.
Yeah. I mean, it's uh, uh, what really amazes me is that people come to us very sick, and then when you go through the foods that they need to stay away from, that's like the most difficult thing, most difficult challenge I get. I've been getting a lot of challenges with that.
What am I going to eat?
Yeah.
What am I going to eat? What is left for me to eat? Just drink water? Maybe you need to drink water.
Yeah. And I don't think people believe that the diseases that they're experiencing or the illness that they're experiencing has something to do with their diet. I mean, even though I'm showing them, and I mean, not everybody, but a lot of people, I'm showing them, and it's right before them, and they're acknowledging it, but yet still, um, when it comes to the food choices, I mean, I just made the conclusion that food is like drugs. I mean, I put them in the same category. It's an addiction.
Mm-hmm.
Um, when a person tells you, I don't know, I can do everything else you tell me, but I don't know about getting off of this or getting off of that. I can't promise you that. Well, you're not promising me anything. You're promising yourself, you know. And those are the sort of things you know, because they come very, very sick, very, very ill, and then you just break it down.
I can't promise you I'm going to give up my fish.
Yeah.
I can't promise you. I can't promise you that I'm going to give up my cigarette.
I mean, I'm, and that does something to my psyche because I'm all the way through. I'm showing them, and they're in agreement with everything. And says, "Oh man, yeah." And then I'm thinking that okay, I'm getting through to the person, and then in the end, they make that statement.
I don't know if I can give that up. I don't know.
You know.
I don't know, man. I don't know. But you know what? What I found out also, which is I found this out a while ago, a long time ago, that if the person who is sick and it is linked to things that they're doing themselves that they need to avoid doing, sometimes I challenge them, you know.
Mm.
I would tell them to just do it for 1 week. And if the 1 week that you do it makes you feel better, go a second week.
Mm.
And those who follow that, sometimes you don't have to say nothing when they come up. Say, Doc, you know what? I tried that thing for 1 week and I couldn't take it the next week.
Yeah.
Or I tried for 2 weeks and I didn't want it anymore. You know, I felt I could do without it. And then I feel so much better. My
Right.
friends are telling me how I look better. You know, sometimes I know we pull people off of death's bed and help them to overcome conditions that if they only change what they're doing, the body responds
Mm-hmm.
positive.
Mm-hmm.
You know, because some things that are being done by all of us are actually destroying our organs.
Yeah. Yeah.
You know, like there was one guy who is he's a body man, car body. You know, repairs cars, repair the body,
Oh, okay.
the vehicles, and he sprays them.
Ooh.
Yeah, he spray paints them, and he does it without a mask.
Oh, occupational hazards.
He does it without a
It's a lot of
mask.
them.
He's breathing
Yeah.
all that stuff all the time, and then um, he realized that his breathing, his ability to breathe,
Mm-hmm.
was being reduced. His capacity was being reduced, and he's breathing harder and harder to breathe. And then when when we screened him, when I screened him, and I realized what was happening to his lungs,
Mm.
I didn't even know what he did. I asked him, "What kind of work do you do?" And he said, "What he does, I fix body. I'm a body repair man. I spray cars and spray paint." And I said, "You know what? I know you don't wear a mask because your lung capacity has almost expired."
Oh.
Yeah, he doesn't live.
You didn't live?
No,
Oh, wow.
he didn't live. He didn't live long. He lived maybe a month, and then he just went.
Yeah.
Can you imagine spray painting and you breathing in that paint, and that paint gets into your lungs, and what it's doing in there? How are you going to get that out?
Yeah. And people doing all, it's occupation, like even welders have a problem too.
Same thing with the welder and smoke.
Welding, and then it's a profession, it's the way of life, and they're just been doing it for years, and they haven't had a problem until one day they realize that they can't take a deep breath.
Yeah,
You know,
yeah,
environmental, occupational, problems. Uh, and the same thing with miners, the ones that mine for
oh
gold.
yeah, and the coal. Yeah,
The
you see
mine-
that?
yeah, dealing with the mercury, burning it and inhaling it and all that stuff,
Yeah,
and they cannot. Eventually, they're shaking. At rest, they're trembling and all sorts of things happening to them. And we don't. The thing with our bodies, it is very. Uh, you can only push your system so far. It is compromised, but then it's compromising. As you do these things, your body tends to tolerate. They call it tolerance. It tolerates it for a little bit, but then not knowing that as it tolerates what it's exposed to, you're actually taking it up at a different level. Everything else has to follow that tolerance. You got to breathe shorter breaths because you can't take the deep breath, and you're breathing faster, your heart beating faster. Everything else is compromised. And it's a slow death, really.
yeah,
You know,
yeah, and it's
So-
you're gonna be tortured because it's not easy to be alive and you can't get oxygen. You in the open air, you out where you can breathe. You're
Yeah.
supposed to be able to breathe, and yet still you can't breathe.
I mean, it's sort of you know, we do things every day and we don't realize the consequences of it. Like the people who do the clothes, and the
The dry cleaners.
dry cleaning. Yeah, they're exposed to all the chemicals. You know, and they've been doing it for years, and there's no problem. So they think.
I can tell you that because I used to do that. I used to do that in Alabama at Oakwood College. It's
Mm-hmm.
university now. Yeah, I was in charge of the facilities there, and
Mm-hmm.
eventually I owned a couple of them. And I know about the perchloroethylene,
Yeah,
all that is used to dry clean the clothes and the garments, and you're in there and you smell that perk, and
yeah.
yeah, it eventually
Clothes look nice, but you're dead.
you can get cancer in the lung and all
Yeah,
of that stuff. Yeah, yeah.
you know.
I know that. That is something I know. But
Yeah,
I was able to escape that a long time ago, and when I realized what was happening, you know.
and it's
But
the same thing with diet too. I mean, there's certain foods that we eat, we don't experience the repercussions immediately,
yeah,
but eventually we succumb. You know, uh, it's sort of like we keep saying the same thing because it is happening all the time. It never change. Your diet is what really caused many of us to be ill, or most of us. You know, and if we were to really sit down and assess what we're eating, and then how the food is prepared, you know, uh, the way that it's done, you know, has a lot to do with with a lot of things too. I mean, people they're concerned about the water, but then they don't drink the top water. But then if they're making rice, they use the same water, right?
hmm
They don't go and get filtered water for rice, do they? To make the food,
hardly.
if they don't wash a fruit,
They make the tea. They use the same
make the
water.
tea, you know. So
Yeah,
it's like and I mean I'm saying it, but I'm guilty too, you know, because you don't have it's so like it reflects sort of reaction, you get a piece of fruit and you just turn the pipeline and wash it, but you don't like you don't instantly recall that this water is not good for drinking, not even bathing actually, but we bathe with it anyway.
you're moving the wrong side. You feel in the way
Oh,
in the left.
I'm out of the line.
But I always try to advise persons, and I advise you too because I did it myself. Install a filtration system in your home that can filter at least the water that you drink and cook with. If you put a filter on your water that comes in, you can see the difference in your toilet bowl.
But you're not going to see all them, all
When you flush it, you
the
will
dirt
see
and
the
all that.
clarity of the water in the toilet bowl,
Yeah.
much as what happens in your system. You know, um, in every home that I go to, that
Mm.
I dwell at, um, the system is installed
Where
because
you
I know
where you put the filters on the pipe coming into the house?
you
Or
can put it on the main pipe coming into the house.
uh,
That is if you want to also shower with the water,
yeah.
because it will filter all of that. Or you can put it on the water at the pipe at the point where the water comes into your sink, so that when you wash dishes or you wash your fruits or you want to drink water that is at least filtered properly, you can use that water there.
Hmm.
So you can make a decision to put it in a place where the water is ingested, either in food or by itself. So I advise persons to do that,
Hmm.
and I'm advising you to do the same thing.
Oh
It's
yeah,
not
I have to do that. I
very
really do.
difficult, and
I really do.
it's not hard to install either. All you need is it's some good mechanical skills, and you can mechanical and plumbing skills, and you can do it. That's all you need. Or you get someone who has the skills to put in, because
Yeah.
you cannot pay for the disease that will be prevented when you put that filtration system in, and you look at what you consume now versus then. So water is very important. I had a patient and I want to remind person that they can call in, and if they have a concern or a question on their health, we can answer it live on the program. I know persons are they're timid to call because they don't want somebody to recognize their voice, or they don't want to. But listen, when you're sick and you need help, it doesn't matter. You let someone who can help you know, this is what I need. This is my problem. What do you think I should do?
Yeah.
So if you have a problem and you want us to address it for you, you can call. It's free. You don't have to pay for that. The number should be on the screen there. You call in, or I can tell you what it is. It's 231-6477. If you're on YouTube, it's 231-6477. We can't put it on our screen here, but it's on the television screen. But I'm telling you, it's 231-6477. Area code 592. You can call it.
Yep. Everybody's concerned. It's a strange thing you just triggered in my head. The HIPAA laws and stuff. People are concerned about their medical uh, confidentiality and the medical history and things like that.
Yeah,
They don't want nobody to know anything. The
yeah.
thing is, what really rings loud to me is that people may not want you to know that they have this disease or that disease, but when you're dead, they found it anyway.
Oh, yeah.
So what benefit is it to you, other than you keeping your privacy? I mean, a lot of times, if people know stuff that could be of help to somebody, and you don't want to say something, and they're not able to help you. But just sometimes saying something. I mean, I'm not saying going to broadcast your fears to anybody, but just saying something about your situation. Like some of our patients, they come to us because uh, they were amongst uh, uh, a group of people, or they were talking to somebody about what was happening to them, and the person identified had similar conditions or situation, and they were able to direct them to us. You know,
Hmm.
see what I'm saying? So if that person never said anything, they would never be able to come to us to be able to get help.
Exactly. Exactly.
You know, I, I
Hmm.
I had a patient like that. Somebody called me this week, as a matter of 2 days ago, and I know we don't really advertise. And then my first thing is, how did you hear about us? She said about, I was talking to somebody I met, and I was telling them what was going on with me, and then they told me that they had the same thing, and then they recommended you. You know, so sometimes it's good to say what's
Oh,
going on
yeah.
with you. You
Oh,
know,
yeah. Yeah.
sometimes. You know,
Um, Look, when someone comes to see us with a problem that they have, they know maybe 10 other persons who are having the same problem that they have. So when they come and they get the results, once they follow the rules, that I gotta really um, say this: if they follow the rules, 96% time they're gonna get the results.
oh
96%
yeah,
of the time, and um, there's no question if your body system if your body system is reporting to you and saying to you that, look, this is what is happening to me, and in order for me to get better, you need to avoid chicken, you need to avoid fish, H. pylori particularly. You need to, avoid certain types of fruits and all that. If your body is saying that to you, because it's not us that is saying, it's not me that's saying it to you. It is based on what is detected wrong with you that automatically the device puts it together.
Mm-hmm.
That these foods should be avoided if you intend to get better.
Mm-hmm.
So I gotta keep saying that all the time because people are thinking, "But doc, you put me on this or you take me off of that."
No, put you in anything.
We don't take you off of anything. It's you taking yourself off of it from what is wrong with you.
Yeah.
I was going to say about this about someone I saw just recently, and she's not seeing. Okay, and I'm trying to get her to be able to see. I'm trying very hard, and apparently your son couldn't take it anymore. So he said, "Doc, you know what? I got to tell you, this lady don't drink any water."
Oh boy.
I put a bottle there and I leave and I come back and the bottle is just a little bit gone from it and the rest of it is there and I gotta drink it.
Mm.
And guess what? The person is constipated.
Well, definitely.
Have to be constipated.
Yeah.
You're not using any water. How you expect your body to function? How you expect your brain to function? How you expect your arteries to clear themselves? How do you expect to have smooth motions? How you expect your kidney to function? How you expect to remember anything? If you don't use water or liquid, maybe coconut water, something, I say, listen, get some lemon and make some lemonade and give it to her. Put a little taste to it. Maybe she'll drink it then.
Mm.
But you cannot expect to have vision or good vision when you don't want to drink any water. You cannot expect to have a smooth motion or bowel movement when you don't want to drink water. Your stool is going to become like cement.
Yep. Hard.
Hard. And then you're going to have hemorrhoids or pile. And then you're going to have bleeding. And then, it just goes from one stage to the next. So I plan to I have a video on the importance of water. I think the theme of this video is water can save your life, something like that. And I would show it from time to time. I think I'm going to have that play.
It's true though.
So that persons can see the value of water, how important it is. So we're saying to put that filtering system in your home.
Mm.
And the other thing is that when you put that filtering system in your home, you don't have to buy water anymore.
Yeah. Give me 1 second. I'll be right back.
You don't have to buy water because your water that's coming through your tap is filtered. It is all the matter for the most part, and you want to get a good system. It's taken out of it, and what you're getting is a state of water that's pretty pure. And if you don't believe me, when you've put that filtering system in your house, a proper one, and you fill that glass with water, put a clear glass, and fill it with the water from the tap when you put the filter in, and just leave the water in the corner. And every day you look at that water. You look at that water for 1 day, for 5 days, for 7 days, for 10 days. That water still stays the same way. Why? Because all of the contaminants have been taken out of it for the most part, and you will have a clean glass of water there for weeks. For weeks. You do the thing. Don't put the filter in and fill that glass with water and put it down in the same corner. As a matter of fact, you put one next to that glass that is not filtered. You fill the glass with the filtered water, and you fill another glass with the unfiltered water. Put them next to each other.
Mm-hmm.
And I bet you that within 24 hours to 48 hours, that glass with the unfiltered water will have sediments at the bottom. And the other one is going to look at it like, really? The one that is filtered will look at the one that is not filtered and say, really? This is how I used to be? Well, imagine when you don't filter that water and you drink it out of the tap, what happens to your inside? Where do those sediments go when you drink it?
They go in you. All those things,
the simple things like that, people don't think. A simple glass of water from the tap could create a problem for you. A simple glass of water. Filter your home, filter your water. The next thing I say, and this is a program of advising people because we want you to avoid becoming sick. The next thing I say is that we're living in an environment where there are mosquitoes. Lots of mosquitoes.
Yeah.
Sometimes flies. You know? Put screens on your windows and doors. Get the screen or the mesh on your windows and doors and avoid those flying insects from coming into your home because those insects could be bringing worms, mosquitoes come in there, they could be giving you diseases that you don't want because you don't know where they come from before they come into your home. When a mosquito fly into your house, you don't know where he was. He could have just bitten a dog or a deer or a cat.
Yeah.
And he comes in your house and he bites you and he deposits something in you that you don't want.
How many times can he bite something though?
He can bite them as long as he can bite.
Somebody told me when the mosquito, once it bites you one time, it won't bite you again.
I don't believe that.
You don't be able.
No.
Well, I don't know.
I have seen mosquitoes. I have literally seen mosquitoes that can hardly fly.
I mean, they're full.
They're so full of blood that they can hardly fly.
Wow.
I have seen that. So if he's full of blood like that, if he bite you one time, he must have been biting you for a long time.
But he's a good drinker. He might go up and all.
Maybe he's a good. Maybe he got a big throat. Maybe he got a deep throat.
Or you get a long straw.
You know? Yeah, maybe that because
good suction.
Listen, I know mosquitoes that have gone to college. They went and they come and they bite you, and you try to hit them, and then they're not there. They bit you, and you did like that, and they're gone. They're gone. The moment you twitch, they fly away.
Yeah.
So he's already bitten you, but he ain't full yet. He's going to look for somebody else, if not you, to come back and bite again.
You can bite you many times until he's full.
Listen.
Wow.
If you feel the mosquito biting you, he's already bitten you. If you can feel him biting you, he bit you already.
Yeah.
And if you don't kill him, he can come back and bite you again.
Yeah.
So I don't believe that part. That's what I don't believe. You gotta prove that to me. If he only bites you one time, I doubt that.
He bites you one time and then he tastes the blood and see if it's good or not.
All right. Well,
let us do another person.
Let us do just a little reasoning here. If they say that the mosquito bites an animal, okay, maybe somebody's calling to certify that. Hold on, let me see. Good evening.
Good night. Is it when I could come in and see doctor?
All right, you gotta call in the morning about 8 o'clock and get an appointment. Yeah, call about 8 o'clock in the morning.
Okay.
But the clinic is closing off the end of this month for a little break. So if you want to be seen, then you have to call tomorrow and hopefully get an appointment maybe next week.
Okay. All right.
But do you have an issue you want to talk about? Is there something that we can share with you or so?
Yeah. I get right now I get in the chest. I'm getting every pain in my chest, and the belly, and my back.
Ooh.
And my 2 foot get a burning sensation within the leg pad.
Okay. First of all, I want you to turn your television down a little bit. I'm getting a little feedback in the back there. Right? Because we're going to try to address some of your concerns. Okay?
Okay.
Turn the volume down for me a little. And listen in the telephone, right? You could put your phone on speaker and you can listen. Now you said you're getting a burning in your foot,
right in the chest.
in your
I
chest.
get a pain. I get a pain or burning in the chest, the belly, and the back, plus the two legs, just before the knee,
Ah,
and
before the knee,
within,
before the knee coming up or going down.
right, coming up to the just within the
From the ankle to
just
the calf to the knee, where?
let me say from the leg, go down just before you reach the knee.
Okay, okay, all right.
Uh,
Now,
and the chest, right across between the two body, and the belly, the back, pain, and it's a good while it's going. I go to the hospital, and we were going to they're going to give me a bore on my hand, and this at Caribbean Art Institute and something. They said nothing in my heart, but they give me a date to go back the 4th of August at the stomach clinic. But after I realized that the other year they decided to call and find out.
all right.
And
Well,
right now it's paining me.
okay.
No? Sounds like you have several different things going on at the same time.
Can you hear Dr. Richard? Can you hear him?
Just a little bit. You could speak up a little bit.
Yeah, you sounds like you got several things going on at the same time. With your burned stomach, it sounds to me like you have some H. pylori. Now let's go back to pylori. And you have
Right. That's what you're saying. Exactly. I went in from box and I went box and clinic and the nurse explained to me. When I explained to she said she suspect the same the word that you use as H. pylori.
Mm-hmm.
She expect.
yeah, you have an ulcer. That's with your stomach, and maybe you having some reflux. That's why you're having burning in your chest. We're gonna have to assess whether or not it's your heart or it's just heartburn, because the acid from your stomach sometimes it goes up the esophagus, and the esophagus has to pass through, goes through your chest, so you might be getting some heartburn from that. The other thing is I'm suspecting with your legs. I'm suspecting that you may have some problems with your blood sugar. You're having some problems with your legs. Does it feel numb? Does your finger feel numb and tingling sometimes too?
Yeah, the finger is feeling numb something.
Yeah. So I'm suspecting
And
that.
which is that I am diabetic.
Yes.
You are diabetic.
So that's what it is. That's what I was going to tell you. It's you're having some problems with your circulation there. Okay. And that's an indication that anytime you're feeling there's numbness and tingling, and then sometimes in the middle of your back it's paining you, that means your blood sugar is high. And sometimes maybe you eat a meal and you sit down and you fall right asleep. Does it happen to you sometimes?
I didn't get you clear.
He said
No.
sometimes you eat a meal, and the moment you finish, you sit right down there and go off to sleep.
Right, and in the night now to be that, in the night I don't sleep. I ain't getting rest.
Okay, so at nights you can't sleep. So, that is another issue that we can look at. But all has to do,
During the day, even during the day, it's happening. I can't even sleep and I can't sleep.
yeah, during the day, do you sleep though?
You say you can't
No,
sleep.
doctor.
Can't sleep in the
No,
day.
no.
Nor in the day. Oh, okay. So it sounds like you're having some metabolic problems, and you can come in and we can assess what's going on with you. And
Yeah,
we'll help you.
it sounds complicated, but it may be that one condition is leading to another, if you understand.
Right.
And what has to be addressed is not only your diabetic situation, but your digestive situation. Okay, it sounds like you're having some digestive disorders and some bacteria that is present that needs to be addressed and dealt with, and some circulation issues as a result of maybe your dietary habits.
I'm glad if I could come in to see you when I could come.
Well, tomorrow is Friday, and I know tomorrow is probably booked already. But if you get here early enough, either myself or Dr. Richard can see you and try to get you on a path of healing.
Okay. And if I can't make it tomorrow, what other day I could
If you can't make it tomorrow, then you could do it on Monday.
Monday. All right, definitely within tomorrow or Monday I gonna come.
Yeah,
Definitely.
try and make your way there. Call and get the information you need, and try and get to us, because if you've gone all over and you couldn't get help, then obviously um, they're not finding what is really wrong with you, and we will find what is wrong with you.
Okay, did they mention we are going to find with Alberton?
Just call. It's not in Alberton. We moved from Alberton a long time. We moved from Alberton years ago. It's in
So we are going to find you.
It's in Kitty. It's in Kitty now almost immediately across from Windjammer Hotel, next to the daycare, next to Kiskadee Daycare.
Next to daycare. Next to the daycare.
Yes, next to Kiskadee Daycare. But I would suggest that you call the same number in the morning and get the details that you need, okay?
All right. Okay, Doc.
All right, brother. You take care. Thanks for calling.
Bye-bye. Thanks very much.
Go then. Bye. Yeah, that is you hit the hammer on the nail there.
Yeah.
In the pretty much what is happening with his body and what they were talking about. That condition that he has is a common condition in many persons. This country is laden with persons with those problems: H. pylori bacteria, gastroenteritis, coli bacteria, and a lot of those have to do with what we do either at home or from places we consume food from. How it's prepared, if it's fresh, if it's heated properly, So we cannot advise persons enough on the importance of ensuring that the foods that they're consuming will be like medicines to their bodies. Yeah, so I know he's gonna come because he sounds like he's really desperate to get help.
Yeah, I mean, and the thing is, they probably went to all over and they couldn't put their hands on H. pylori.
He said it, and sometimes I can understand why they cannot diagnose totally, because they probably don't have all of the necessary tools to be able to come up with a full diagnosis. When people screen here with us, there's no question that we're going to find what is wrong, because we're screening you from head to toe.
That's right.
And we're comparing you to a perfect system that should be, and whatever your imperfections are, that's what we're going to see. So there's no guesswork here.
No.
There's no guesswork here.
Nope.
But Dr. Richard, guess what? It's 7 o'clock.
Oh, you're kidding me. Time went quick. Just one call.
You probably have 2 minutes more. Let me see if he sent me the message already.
Oh.
I can see it. I'm looking at the time there, and it looks like we only have 2 minutes.
We're looking forward to another call. So.
Oh my.
Well.
But more persons need to do what he did. He was, in the beginning, he just wanted to get the appointment. But I knew that we can help him to begin the journey of healing, and what he needs to do right away is to stop using food that is hot. Heat the food, kill the bacteria, and allow it to cool to body temperature before you eat. And then stop eating and drinking at the same time. Many persons eat and drink. They have a cup of water or a glass of water or juice or drink right next to what they're eating, and they're eating and drinking at the same time, and that is diluting the enzymes from your stomach from digesting the foods properly. And then some people don't chew properly. I have friends that I know that when they eat, I know they're not chewing, because you can hear the food, how they eat, how they chop the food. It's not being broken down, so they swallow it, and then they expect the stomach to break it down. It doesn't happen like that. So we have to spend some time going over the right way to masticate, to chew, before you swallow and all that, to help the digestive system to work less hard. Listen, it's a long journey to help people to understand the importance of eating correctly. Not only the way to eat, but what to eat and how to eat. So Dr. Richard,
Mm-hmm.
um, it's 7 o'clock,
Oh, okay.
and I know it's time for us to get off the air.
Okay.
Yep,
Until
six
next.
5 minutes. We have 2 minutes more,
Oh, okay.
right? 2 minutes more, so we can wrap up. Let's wrap up what we have to. Well, I want to mention something before I forget again. We're closing off the clinic next Friday, next Thursday, because next Friday is a holiday here,
Mm-hmm.
and the clinic is going to be closed for our summer break for 1 month, right? So those who need to be seen next week, because after that it's going to be September. Okay, and we're probably gonna. I don't know if we want to keep doing the program in the year or should we take a break.
Huh?
We have to make a decision on that if we should keep the program on.
Oh, take a break, man.
I normally just take the break.
Yeah, take the
I
break because
guys
you're not gonna get another one.
take a break for the month and come back all
Yeah.
ready to go again.
Come back fresh and
Yes.
ready to go.
So we got a minute more, Dr. Richard. So anything you want to say before we go off?
Yeah, just people. Let's practice safe preparation of food. Wash your hands. Use soap. Wash. Take care of yourself. Use water, man. Healthy water. And make right choices. Make good decisions. And just be prayerful.
All right. Well, I want to thank you guys for participating. Thank the operators and everyone in the studio. We appreciate your assistance, and we're glad that we're able to get the word out there, the right word out there in the heads of the people, to those who are interested and who care. So until next week, I think we have one more to do before our close off. Until next Thursday, I want to thank you for participating. God bless you, all of you. You too, Dr. Richard. And those of you who are sick that we can help, don't be afraid to call us. Okay, we're glad to help you to at least be on a journey to get better. Okay, until next time, Dr. Haynes saying good night, so long, God bless you.
God bless. God bless.